sucking on a mint.
If I don't cough through the whole thing.
All right. Are you feeling okay?
Yeah. I feel great. I think I need my humidifier on that night, though.
Happy Thursday, Live in Truth community. Welcome to another episode of the Live in Truth podcast. I am your producer, Sean. I am joined by your host, Nifiah. Here we go.
Here we go.
So if you listened to last week's episode, you will know that we ended on a daunting note. We were informed that something sensitive was coming up. We did head to toe last week, but this week we're going to get really specific and go below the belt. And if you haven't caught on by now, we're going to be talking about diabetes and your sexual organs and your sex life. I'm going to hand it off to you. Let's get right into it.
As Sean already stated, we'll be talking about diabetes and sexual health. And this is a very important topic. In this world that we live in, sex is over-sexualized on TV, in our music, in our communities. However, we don't discuss sexual health where you should be discussing it, and that's in your doctor's office. What's more unfortunate is that in healthcare, we don't discuss sexual health when it comes to diabetes.
And just to carry on with what you were saying, it's almost like sexual health is always exclusively spoken about as its own entity and never something that could be tied to a chronic illness or any other type of illness, almost like it exists on its own always, and it is never caused by something else that could be going on with you.
And that's very unfortunate because in healthcare, we know that many illnesses does cause sexual dysfunction, and it doesn't matter if that dysfunction is physiological or psychological, especially when it comes to chronic illnesses or lifestyle diseases. Most people experience some sexual dysfunction.
What do we mean? We're still focused on diabetes. So along the lines of diabetes, to narrow it down to a chronic illness, what are some of the most common dysfunctions that could come out of that diagnosis?
Well, diabetes is one of the most common causes of erectile dysfunction. Many men with erectile dysfunction later learn that they have diabetes. So they might have been experiencing the issue, not sure what was happening, and then later get a diagnosis of diabetes. For men and women both who already have diabetes, sexual problems can indicate major nerve damage, blocked arteries, or even an issue with your hormones.
I think it's really interesting that you say that men who experience erectile dysfunction usually learn that they were also going through diabetes after the fact. And I say that because I see a lot in the media and in advertisements that medical companies really capitalize on the shame of sexual dysfunction. So, for instance, there is a very popular blue pill going around, and the whole campaign is it's very hush hush. It'll discreetly come to you in the mail. You don't have to go see your doctor. You don't have to see a medical professional. You can just get this pill and it'll fix all of your problems and you can get back to being a man, So
Right.
they're really capitalizing on the shame. It's almost like they don't want you to talk about your sexual health.
Sexual health is very uncomfortable to talk about. And as we started this segment, I talked about our world being over-sexualized. You're not ashamed when it's on TV. You're not ashamed when it's in music or however it's being exploited. But when you are in the privacy of your doctor's office in which this issue should be brought up, you are embarrassed to bring it up. I think we have to do a better job as healthcare providers at bringing up this discussion or at driving this discussion so that we can ensure that all of our patients are treated properly.
And before we go any farther, how do you think we can really go about destigmatizing sex in real life and sexual dysfunction? And how can we get people to sort of step out of their own minds or their own bodies and say, hey, this is a conversation we should be having. It's not something that I should be so hush hush about and never say anything to anyone else about.
I have always been a big advocate to discuss sex openly. And don't think I'm weird or anything, but sex is a natural process. We are sexual beings. It's a natural process.
That's how we all got here.
That's exactly how we all got here, if nobody knows. We are sexual beings, and it should not be stigmatized as a bad thing. And when you are in a consensual, good sexual relationship, you want that to remain good. And you can keep those fires burning by having the proper discussions. If something's going on, and we're not talking about STIs right now, but if something is going on in that arena or something different is happening in your body that you know shouldn't be happening, you need to discuss that with the appropriate professional.
And I believe that people a lot, even if you yourself know something is going on, because of the shame, people like to go at sex on the most shallow level. So say you are experiencing some dysfunction, you may go to blaming your partner or, blaming something else, but not really trying to say, hey, is there something going on with me? What's going on with my body? What am I experiencing that could be causing this? I feel like people always try and
put it off on something else.
Yes.
They don't want to take the blame forward, or they don't recognize that it could be them. So back to the subject at hand, the causes of ED, and that is the abbreviation for erectile dysfunction. It does not mean emergency department. Well, kind of does mean emergency department, but the causes of ED are numerous, but generally it falls into two categories. So organic or psychogenic. The organic causes can be divided into 5 categories, and that's vascular, traumatic, so that's an injury or something that happens, post-surgical, neurological, endocrine-induced, and drug-induced. So those are some of the things that you were talking about. You're not looking at what's happening in your environment that could be causing these issues. Psychogenic causes could be depression, performance anxiety, and relationship problems. Again, you have to also look inwardly to see what's happening. People who experience diabetes, the main risk factors are neuropathy. We talked about this in the last episode. Vascular insufficiency, poor glycemic control, or your blood sugar is not controlled, high blood pressure, hypertension, low testosterone levels, and possibly a history of smoking. Smoking leads to peripheral vascular disease. That's a topic for another day.
And just to be specific, when you say smoking, is that smoking across the board, or is that smoking cigarettes or tobacco, or is this caused by just like the inhalation of smoke?
Smoking in general. It's the smoking, the consistent smoking that increases your risk for peripheral vascular disease. So people who have a long history of smoking, whether you're smoking cigarettes or marijuana, you are increasing your risk. So we talked about neuropathy. Neuropathy or peripheral neuropathy is a result of the damage to the nerves located outside of your brain or your spinal cord. Those are your peripheral nerves. And it causes weakness and numbness and pain. So usually in your hands and feet. And so we touched on that last week as well. It can also affect other areas of your body, including your digestion, your urination, and your circulation. And your circulation has a lot to do with your erection. And so there are several causes of neuropathy. And as I said in the last episode, if you didn't go listen to it, go and listen to it. Diabetes is the number one cause of neuropathy in the United States. And erectile dysfunction is usually a neglected complication of diabetes because of the stigmatism of discussing sexual health.
So you say neglected. So to me, that sounds like even in a medical setting, because of the stigma around it, is that something that is kind of looked at last or put to the side when, going down the list of how to help a person or what's wrong with somebody going through diabetes?
Exactly. Sexual health, even though it is truly high up on your personal needs, when it comes to health, that's the last thing that the providers look at. We, in the moment, are trying to save your life and get you out of crisis situation and prevent or reverse a disease process that's happening. So your sexual health is not the priority. But I would also like to say that physicians and clinicians are not very comfortable leading that discussion. So it is often just left off the table.
It's kind of put, maybe if the patient brings it up, then they're willing to engage. But perhaps if it seems like the patient isn't willing to be the person to lead that discussion, like you just said, it may not be brought up due to some uncomfortableness or...
Correct. I remember a story that I would like to share with you all. As I was completing my doctorate, I worked with a physician who saw a lot of young to middle-aged men, and he told me, none of these men are going to want to talk to you about these personal things. They're not going to want you to talk about their prostate or do prostate exams or talk about STIs. And I said, well, why not? Why wouldn't they want the help? And in one incident, I had a man in his late 40s who was experiencing an STI. And we're in the room together, and I have my physician partner there with me. And he asked me to step out of the room so he could take a look at what was going on. And I was just bold. And I said, don't be embarrassed to talk about this. What if you can't see a male provider and your only provider is a woman? What if I was the only person here today? Would you not tell me about this? And you would continue to suffer this? And he thought for a minute and he says, no, you're right. You're a professional. I'll show you. I want you to help me. So I'm telling that story because I don't want men to be afraid, if you have a female provider, to share these things. And you might find that you're more comfortable speaking to a female regarding these things.
And just from personal experience, since you are my mother, obviously you were my first doctor and my first nurse. So I've always been very comfortable in the hands of anybody, no matter how I identify, who is a professional and whose expertise I trust. And a side point, and we don't need to get into this, this is a conversation for another day, but I also just think that that is a even larger issue. Men, and maybe it's the same for women, but I'll speak for myself and my people, men being uncomfortable communicating with women about sexual health and sexualness and sexual needs. But like I said, that's a whole nother kettle of fish for another day.
Right. My whole life, and I'm near 50, I've only had male gynecologists. So I am comfortable with males, but initially I was not very comfortable with males. But again, you think of the world that we live in, males dominate the medical profession. So it was a time where there were not a lot of female gynecologists. It was only males. So you had no choice. Now you have a choice in who provides you your care.
So getting back into the conversation about ED or erectile dysfunction, I know that not only diabetics experience erectile dysfunction. So what is the dichotomy between a person with this chronic illness versus another, maybe, young adult, the middle-aged man? What is the likelihood differences of experiencing erectile dysfunction?
Well, studies suggest that erectile dysfunction is more prevalent in men with diabetes at a rate of about 35 to 75% versus 26% of the general population, or I'm going to say individuals who are not diagnosed with diabetes.